on the brain,
yes.
and you told her pre-stroke. So then I left, and she'd already done my feet. And the feet, the first time were like 40% improvement. This time was still 40%, but maybe a little bit more. But my face is the thing. This side of my face is numb.
Before
It was numb. So then all of a sudden I put my tongue in my cheek, and I'm like, oh, I can feel my cheek. And then I went like this, you know, and I could feel them both the same. That's the first time since the stroke. And then I'm sitting there thinking, oh, and you know, when you have a dental and the Novocaine wears off and it tingles, it was going all the way up my face, up into here. I never knew this was numb, but I guess it was, because it isn't anymore. So all this side of my face is numb. And I noticed before this face was kind of sagging. It still does a little bit, but there's a huge improvement. Maybe you have to look at the picture, I don't know. But there's a big improvement in the
drooping,
the sagging thing. And when I eat before, I can't feel when the food falls out here, so I look like a baby. And that's better.
So you said that you have, how long ago? You said you have a stroke, right?
1 year ago.
1 year, and then it would, what side? What side of the stroke was the right side?
It was on the right, it affected the left. Yeah.
Okay. Then the second visit with the last time with the
laser.
The laser with the stroke setting.
You put the stroke, pre-stroke setting. Like, wow. Yeah, so so this, I'm happy about the face.
Good. And then you said that your foot is still that
well, it's still, you know, the left foot is still, it still hurts, but not like before. Before, when I would just get out of bed in the morning, every step we push, it's like, ow, it's like pins and needles, hurts every step. It still hurts, but it's more tolerable, certainly.
Okay.
So that's pretty good. Well, the first treatment was.
And then, why don't you share with me about the adjustment too, right? Your first time with the adjustment, and how does it feel?
The adjustment.
Sleeping, right? And how is that?
Yeah, the sleeping is a million times better. This arm I couldn't move further than here, and I can now.
Great. How many treatments you got?
Two.
Okay.
You treated this shoulder more on the second treatment.
Yeah.
And
just want to make sure.
Huge improvement. This, I had a little pain in here, but before, from the pain, I couldn't move past there. So I mean, I still want you to hit this shoulder today because it still hurts.
Okay.
But I can move it. That's nice, and the neck is better.
Or you have a difficult time.
Couldn't go to sleep. Couldn't stay to sleep. And after the first treatment, I slept like 12 hours.
So you always try to recover from a long time of all that.
But it's like solid, restful, peaceful sleep. Nice.
Great. Thank you for sharing all this.
Yeah, a lot.
Mary.
It's a lot.
Right.